and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And I am very excited to be here today with Illiyin Morrison, who will be our keynote speaker at the upcoming Gold Midwifery Online Conference. Welcome, Illiyin.
Thank you so much for having me. It's a pleasure.
It's wonderful to have you here. You will be presenting on a very important topic, from birth to healing, the power of debriefing in perinatal trauma care. Such an important topic. We have made this keynote presentation open access, so it's available to everyone without charge, without any fees, because we want to be able to make sure that as many people as possible have the opportunity to listen to you, Illiyin. And we're going to talk about the presentation in just a moment. But first of all, I want to know a little bit more about you. You are an author, you have a podcast. So talk about you and the amazing work you're doing.
Yeah, so I'm a midwife. I qualified nearly 7 years ago now. I worked clinically for a period of time in London at a big hospital, and then realized that clinical work wasn't for me. Although I think I realized that a long time before even qualifying. And I think it's really important to distinguish that as midwives, or, people who work in certain professions, we have so many hats and our skills are so transferable. And I know that it felt like a huge leap for me to be a non-clinical midwife because of the idea that we have to be clinical. But I moved into the realm of birth trauma following my own very difficult birth with my daughter. And it's really kind of grown in terms of looking at it across the whole perinatal sphere, and viewing things not in isolation, but kind of, everything is connected, and really allowing space for women and their families to feel heard and supported, and for them to get an understanding of what's happening to them. Mm-hmm. And what's happening within them. And so it is the most profound work. It's, other than my children, it's ultimately my life's best work. And I'm very, very much dedicated to what I do. I wrote a book which was published in March of 2023, and it's called The Birth Debrief, ironically. And this is a book that is for women, it's for families, it's for birth workers, obstetricians, lactation consultants. It's a book about advocacy and agency and reflection and reframing and all of those things that we should be doing as professionals, but also as people who give birth. So it is one of those books that I feel was never on the market, and I saw a gap and I wanted to fill it, and it's been I'm very, very proud of it. And I think it's a tool that can be used, and it doesn't have rules, simply tools that you can, they're open to interpretation. And I think that's sometimes what we need, because there's so much nuance in birth work.
Yeah.
So yeah, I've got a podcast, and I work in perinatal debriefing full time. It's international and it's incredible.
I can hear the passion in your voice, Illiyin, really about this topic, and coming from very difficult circumstances, your own birth, as you mentioned. Now, let me ask you this. When you talk to families and women, when you did the work collecting stories, collecting information, sometimes when you ask them about their birth, was it maybe you were the first person to ask them that question, that they maybe turned to you and said, nobody has ever asked me this, nobody had ever listened to me? Did that happen?
Yeah, so what I had a lot of was an expectation that people would think that I want to know all about the birth, because that has often been the highlighted point. Everyone asks that. So how did you give birth? And my first question is always, how are you? And that is a question that they've not been asked. And I think, coming into a space of vulnerability where you feel like you might be exposed with someone that you don't know, it's so important to set that scene and be like, so how are you? Tell me. And when you give people that, and you really kind of say, it's an open question, tell me how you are. It's not, are you well? Which we know can definitely not invite that kind of truth telling that is required in this kind of work. So, you know, I have a lot of people who have not been asked the questions that they necessarily need to be asked. And yeah, it's been fascinating to kind of see where we're lacking and what we can do to serve people better.
Absolutely. I like that. Yeah, because it's not so much about the birth, it's about how are you, right? That question is how do you feel, you know, because from the outside, a birth, maybe even if it was not traumatic, it could look like a beautiful birth. And that's something I learned as a midwifery student. One of my very first birth I attended, I thought, oh, that was a beautiful birth. Somebody played the guitar, the baby was born in the water. And the next time this mother came in, and there was a mothering group, we did centering, and she was asked by the other mothers, you know, who are still pregnant, how do you feel? And she was telling, oh, I don't, this was horrible. And I was really, really shocked about this, because from the outside, that birth looked like the picture book birth, but for her, it was somewhat traumatic. And that's when I realized, wow, we need to ask questions, because just because something looks like this, it doesn't necessarily feel to the person like that. Yes, we have the very traumatic birth. Maybe the baby wasn't doing well. There was a hemorrhage. There was all things going on. But it's also from the outside, good-looking births that we need to pay attention to.
Yeah.
What do you say to that, Illiyin?
Yeah, most definitely. I think it's, you know, one of the most important things is that we aren't prescribing what's happened. You know, we aren't determining that ourselves, and we're allowing people to tell us in their own words. You know, a lot of the time we want to give words to situations. We want to say, that was traumatic, wasn't it? That was great, wasn't it? And we don't allow them to put words to their experiences. And so I think, you know, always those open questions saying, you tell me how you feel. You know, and there are feelings and there are facts, and the two things exist alongside one another, and it's about not using the fact to undermine the feeling, or the feeling to undermine the fact. And so allowing space for both to exist is really important in this kind of work.
Absolutely. Now, there are different kind of debrief, right? There's the debrief we do with the families, but also the debrief we do with the team or other birth workers who are with us, or maybe even not with us. Debrief is important, right? But why is it sometimes, why do we find it so difficult?
Yeah, I think reflection generally is quite difficult. A lot of people aren't in the practice of reflecting, and life is very fast paced, and particularly if you're working within obstetric systems, on the medical industrial complex, or even just in birth generally, things can move very rapidly. And so that slowing down is not often able to be done. And sometimes I think, you know, the birth is ever changing, and there's a lot of defensive practice. And so when you reflect and someone says, oh, you did that wrong, or you made someone feel, we don't want to do it. It's often like, I avoid it because I don't like criticism. I don't want to feel bad. You know, that wasn't my intention. I don't want to know that I've done something wrong or anything like that. And so often we sort of plaster over it and we just keep going. And, you know, I think it's just important to always take that time and slow it down, have a think. That's the only way that we can move forward. That's the only way that we can be in growth. And so debriefing needs to happen, whether it's with your colleagues, with your therapist, with someone who does debriefing, with if you're a doula, with like a buddy who you have, and you just offload, and you don't need to refer to it as debriefing, but it's like, can we have a chat? You know, I just want to talk. But really, for those events in our lives, big or small, we should make some form of debriefing, some form of reflective practice the norm, in order to kind of create a self-awareness and a situational awareness, because as we know, we often find ourselves in these places over and over. And so to recognize that, oh, I remember what happened last time, I thought about it, I thought of like what I would do differently, how I would reframe it, and now I can go in and do it again differently. So, you know, it's a really important practice for us to do, and to understand it's not an attack, but it's just a process of growth, and that is something that we should all aspire to be having.
Process of growth. I absolutely love that. You know, you said it so well right there. Now, some birth workers work in isolation. You mentioned you worked in a busy, big practice and a big clinic. Then debriefing is difficult because of time constraints, right? Like you're seeing so many clients and patients, and that it feels almost impossible to do it. Or some home birth midwives, they practice either just with another partner or an assistant or doula. They might feel like a silo in isolation. So what advice could you give our viewers if they wanted to get started with debriefing and don't know how to put the pieces together?
Yeah, I think it's so small. A lot of these things, they seem like big tasks. And sometimes a debrief is literally a jotting down a note or a voice recording or whatever. It doesn't need to be big. And I think, again, if we take away that kind of, it's your debriefing, but it's more you're reflecting. And so if you're on your own, you can journal.
Mm-hmm.
Just jot some things down. If you have one person that you speak to, then you allocate a time. Like you say, at the end of a shift, we're going to take half an hour and we're just going to talk about what happened in the day. Or you make it part of your paid day. You speak to your management and you say, we actually need this debriefing time because it's really important for our development. And, you have to prioritize it. Once you prioritize it, you can make the time. In many ways, obviously, this can appear like something that's very privileged, but we all have 24 hours.
Mm-hmm.
And so it's about saying, actually, this is important because we don't have the
Right.
same 24 hours. But this is important for me. This is important for us. This is important for the community that we serve. So how can I take 5-10 minutes out of that 24 hours in order to achieve something greater? So when you can recognize what can come from that reflective process, you'll then say, maybe it is important, but you have to prioritize it. No one can tell you that you need to do it. I'm not here to tell you that you have to do it. You choose, you have
Mm-hmm.
agency. And this is what we'll talk about in my presentation, the agency that you have as a practitioner and how you can use it to improve your practice and improve how you feel about your work. And it works wonders. But again, the choice is yours. There is never an obligation, but it's a choice you might want to make.
The agency. I love that so much, having agency, having the power of, making that decision, and realizing that. Fantastic words. Thank you so much, Illiyin Morrison, for being here with me. And we are looking so forward to your presentation here, the keynote for our Gold Midwifery online conference. And it was a pleasure hosting you here today.
Thank you so much.
And for our viewers now, if you would like to find out more information about this presentation, you will find that at goldmidwifery.com. This presentation will be live twice. Illiyin will be presenting live twice. So everybody should be able to figure that out with their schedule if you can. But if you can't, everything is recorded. So you will not miss out on the presentation if you are at work that day or if it doesn't work with your schedule or your time zone. So you will find all the information at goldmidwifery.com. I mentioned that this presentation is open access, so please make sure to share that with all your friends and colleagues in the field as well. And I hope to see everyone at the presentation and the conference. Bye-bye, everyone.